So we get a lot of questions about when you can fly after you've had dermal fillers and Botox. It's a great question. Personally, I like to leave it as long as possible after the treatment's done before the patient flies. I mean, within reason, of course. I'm not going to say, oh, you have to wait 6 weeks or something like that. But ideally, you want to be waiting at least minimum 48 hours after you've had treatment before you fly, but the longer the better. The reason for this is because sometimes complications can present themselves a little bit late. So for example, if you have, a vascular occlusion and it doesn't show immediately, it's normally the next day that you'll see it. But to treat that, sometimes we have to do a couple of days worth of Hyalase treatments in order to restore the blood flow there. And just as well, from a professional perspective, it's good if we can follow somebody up if they do have a complication. We really need to see them in person in case we need to make any further interventions. In addition to that, if you have, say, a little bit of asymmetry or maybe a little bump after you've had treatment done, that's something that we can treat. But again, it's not often immediately obvious. The situation's different depending on whether you're just going on holiday from the UK or you actually live abroad and you're coming here for treatment. So if you're coming in from abroad for treatment, really we need to get everything absolutely spot on before you go home again, because we're not going to be able to do any small touch-ups because you're not going to be here. Botox takes 2 weeks to kick in completely. If you're going to be having a Botox treatment, ideally you would be hanging around for 2 weeks afterwards. I know that's not always possible. The swelling from filler at its peak will probably last about maybe 5 or 7 days. So ideally, if there's a chance that we might have to do a touch-up, try not to fly before a week until after your treatment, just in case we need to see you again. But if you're going abroad and coming back to the UK, it's kind of fine. You can probably fly after 5 to 7 days, and then we're safe in the knowledge that when you come back, we will be able to do any tweaking as and when necessary. So final answer, absolute minimum is going to be 48 hours, but ideally you want to be waiting at least 5 to 7 days. So the things that we worry about when you fly is really just that you're not going to be around should a complication or a bit of asymmetry occur just after treatment. It's not really got anything to do with you flying. Changes in air pressure, I guess theoretically could cause you to bruise. Say for example, if we nick a blood vessel and then you're suddenly in a low pressure environment immediately afterwards, you may bruise more, but that's about it really.